I'm Dr Shagun Aggarwal. I'm a specialist plastic surgeon and I work at the SAN, RPA and Prince of Wales. In Australia, there's actually no law that says that someone has to have a certain amount of training to do cosmetic surgery, which is quite interesting. And in some ways, it's buyer beware, and it's up to the patient, unfortunately, to do their research. And I think just going online and Googling, putting into Google plastic surgeon or cosmetic surgeon probably won't give you the right answer because, if you look at people's website, they all look the same. And I'd probably say even some of my medical colleagues would probably find it hard to know who's trained and who's not. And I think the best way to do that is to really just go to the ultimate body that the ultimate body that actually credentials doctors in hospitals. And if you go to AHPRA, which is AHPRA, and you just put in anyone's name, any doctor that you're about to go see or you're considering seeing, it will actually tell you what sort of specialty or what sort of training they've had. So if they're a specialist in a certain specialty, it will tell you that they're a specialist, and it will tell you the name of that specialty. So if you're in any doubt about whether someone's a plastic surgeon or whether they've had the same training as all the other surgeons that you deal with, like cardiac or orthopedic or whatever, you should just go to that website. I think that's a good point to start. We have a big society that looks after cosmetic plastic surgery. That's called the Aesthetic Society or Aesthetic Plastic Surgeon Society, or ASAPS. And you can go to their website and just look up the name, and you'll know then, okay, the person I'm about to go see is well trained, has the right credentials. You can also infer from the hospitals that they operate at. So, for instance, I work at RPA in Prince of Wales, and big public hospitals only ever trust the surgeons who've done the right training. And all of us have gone through 12 to 15 years of training, and to get a job at a big public hospital is extremely hard, and they will only entrust the best surgeons to do that. I'd say even in terms of the private sector, I work at Sydney Adventist Hospital, and it's a hospital that doesn't just credential anyone. Firstly, you have to be rightly trained, and I'd argue that you have to actually be even better than that. You have to come with some strong fellowships or further training, or you bring something different, and you're really at the top of your game to get a job at a place like this. So I think from the combination of those two things, you can infer that someone's a good surgeon. And I think the third thing you'd say is, go and talk to them, see what their results are, and talk to some of their patients. And if their patients, talk well about them, then you know that you've done all your homework. I think that's the best way to pick which surgeon to do your surgery.